our final lecture of the conference today. Whew. We have the partner Weber Morgan Health Department to help us keep up with our public health. Please welcome Edna Ramirez, and then followed by Kelly McElwain.
Hello, everybody. Thank you for staying, and we're really blessed to be here, and it's a good opportunity to teach you guys a little bit about what we're doing and how we can better support you guys with your patients. So Kelly is in the restroom. She had to go really quick, but she'll be joining me in a bit. So, I don't know how to do this. Oh, there we go. I'm Edna Ramirez. I have my master's in public health with a focus in health education and epidemiology. And Kelly, she has her master's in infection prevention, I believe. And she is in charge of Teen Health and Heal, which we'll be talking about. And I am in charge of COVID infection prevention and our community health workers, which is a new initiative that we've started, and health equity. And some objectives that we're going to be focusing on is how we partner with OgdenCAN, what aging programs we offer, living well classes, and how you can benefit from referring your patients to this, and what other resources we have. So, Kelly, do you want to talk about OgdenCAN?
I definitely can. Hi, everyone. Sorry I'm late. Okay, so OgdenCAN, or OCAN, Ogden Civic Action Network, focuses on the East Central neighborhood here in Ogden, which experiences a higher burden of poverty, low income, and ethnic diversity. Not that that's a burden. But it's a group of anchor institutions, community partners, and also the local residents themselves working together to improve the conditions here. It really works within the scope of social determinants of health, and there are three key areas that OCAN focuses on, which are health, education, and housing. So this is just a little quick overview of some of the subcommittees that OCAN has with the anchor institutions. At Weber Morgan Health Department, we are one of the anchor institutions, along with places like Intermountain Healthcare, Weber State University, Ogden-Weber Technical College. But so you can see that in the green, those are the committees that we run at the health department. So today's presentation is kind of going to fall into that healthy lifestyles area. And yeah, we just really work together to help the community objectives. We've got a little interactive piece for you now.
Yeah, so if you guys have your cell phones, you guys can scan the QR code, and it should be very easy. And as soon as you scan that QR code, you'll just type in those numbers, which is 39, 33, 71, 9. So I'll give you a minute to scan that. And when you guys are ready, just give me a thumbs up and I'll move forward. So I'll just go to the next slide, and I'll still have that QR code and number if you haven't scanned it. But the question is, what are some common challenges you face in managing patients with chronic illnesses in your practice? So just type a word, something that's a common theme. We want to know how we can better support you. Non-compliance. Yes, we've seen that a lot. Fatigue. Yep. Education. Yes, that's a big component. Anxiety. That is a very, very big component that we've seen trending now. Cost of insulin. Yes, we see that all the time too with our diabetic patients. Lack of money and resources. Yes, and that's how the health department comes and connects that with our community health workers. What else? Well, those are really good inputs, and we'll just talk a little bit more about how we can help with those things. So.
Okay, so within the Healthy Environments Active Living programs, which I supervise, we do have our healthy aging programs that go into our falls prevention work. And I'm just going to talk about the two main programs that we run really quickly. Those are Tai Chi for arthritis and Stepping On. So some of you may have heard of those programs. But first of all, Tai Chi for arthritis has been proven to help with a multitude of things such as balance, flexibility, muscle strength, and even things like quality of sleep. As well as the pain and the stiffness that's associated with arthritis. So it's a really good program for that pain relief and also a little bit of falls prevention, keeping people upright, keeping people balanced. And it's a really cool program in that it can be done sitting, it can be done standing, it can be done at home. There's no specialist equipment that's needed. So it's suitable for people that have much more limited mobility, maybe they're experiencing a disability. It's a really good program. And then we have Stepping On. Again, this is a program that's evidence-based. And it does focus more heavily on the falls prevention side rather than pain relief. So what we're looking at here is we're looking at not just the body, but we're looking at falls risks within the home. We're looking at falls risks within footwear or clothing, and we're also looking at medication adherence and the types of medication that people are taking. I'm going to click over. So here's a little short video about Stepping On.
And you can fast forward to like the middle of it too. That way we can get people going.
Here in my home is the best place for me. Afraid you might fall again, which
bit
can lead to
more.
a loss of confidence. Depression.
Right there. Yep. That's a good
To
start.
spot risks and avoid them. And to make changes that really help you stay safe and keep you doing the things you love. Just 7 classes. Doing fun activities with people from your own community who, like you, are concerned about falling. Practicing simple balance and strength exercises. Hearing from community safety professionals and experts, like pharmacists, vision specialists, and physical therapists, who show you how your medications, eyeglasses, and even your footwear make a difference in your falls risk. You'll try out solutions for yourself and be one of the lucky people who is less likely to fall and more likely to keep gardening, cheer on your grandkids, fix a meal, stay independent. And if you do fall, you'll learn how to safely get back on your feet. Falls by 30%. That's a lot. So don't learn more or
Okay.
likelihood.
Well, you guys get the point. It's a really great program. So we just wanted to show you a little clip of what we offer with at least fall prevention programs. And how do I get out to the next slide? Yeah. Oh, okay. So we want to share some success stories because we always want to know, is this actually helping our community? So yes, it has. So one of the stories is I've always wanted to know about Tai Chi. Finally did it, and I enjoyed it very much. It has helped me with my neck, and I have a good experience, and I've healed. It's helped a lot. And we also provide it in Spanish, so we just started that at our Golden Hour Senior Centers. If you guys aren't familiar where that is, that's on 25th Street, right by the library. That's that's an area where we have a lot of our social determinants of health with a lot of people that are diverse or they are low economic status and they don't have that access to healthcare. So that's an area where they go to get those services. And one of the participants says, "Soy más flexible con mi movimiento y equilibrio." So that means I am more flexible with my movement and my balance. So this is another portion that we would love for our providers to refer patients to, because these are 100% free for our patients out in the community. They're called Living Well classes, and we focus on chronic conditions, chronic pain and diabetes, and also Tomando Control de tu Salud, which is the Spanish version of chronic conditions, and Programa de Manejo Personal de Diabetes, which is the Spanish version of Living Well with Diabetes. So currently we started, and we've had 2 classes of chronic conditions and 2 classes of chronic pain and We are working on our diabetes ones, which we're starting to recruit, and we have already people listed on the list to participate. They'll start next month. We have about 13 participants already, which is a great success because we have never had this before in our county. And from those people that have already participated, 20 have graduated, and they continue coming to these classes. So it helps with the social aspect of them coming and getting a support system. So one of the key success stories I would love to share with you guys is the one about narcotics, and that this participant cut their narcotics way down from doing it 5 times a day to once a week, which is a great success story, especially with our opioid epidemic that's going on in our state, and in the nation. But that's one of the ones I want to highlight in these classes. We teach them how to do action planning and how to live with this chronic condition that's never going to go away, but if you learn how to self-manage, you can manage those pains, and it'll be less of a strain for them, and they'll have a support system that they can lean on, because most of our participants that come to these classes, from our data that we've collected, over 60% of those live alone at their house. So going to these classes, they build that social connectedness, which is really important with our really vulnerable populations. So, Kelly, do you want to hit this one?
Something I just want to mention from the previous slide is that, or 2 slides ago, sorry, is that with our chronic pain classes, we've actually held 1 virtually this year and 1 in person, and we had a better graduation rate for the class that was held in person. So again, speaking to that social aspect, getting together, developing friendships. We have a lot of people that use it and then they go out to lunch afterwards with the new friends that they've made. So just wanted to kind of drop that in there as something that we've noticed that's really, really cool. And now to the part where you're thinking, okay, this benefits the patients, how does it benefit me, right? So we want to ultimately do what is best for our community, and at the health department, that includes supporting our providers as well as our community members. So patients coming to primary care appointments less for chronic condition management lowers their healthcare costs and the copays that they are faced with ultimately. And in turn, that frees up time for you guys as providers. You can see more patients, you can use that free time for quality improvement projects, and then it also kind of segues into patient ratings. Systems like Medicare Star and HIDIS, where patients would be rating you on the quality of care that they receive, chronic conditions management, that all factors into those ratings, definitely has the potential to raise if they feel that they're being, having that open dialogue, being listened to more, and they're seeing an improvement in their chronic conditions management. And then just a little bit of data over on the side, I think from a study in 2013 about cost reduction, et cetera, et cetera.
I just want to also emphasize all these programs are evidence-based, so we're not just making these up. These are backed up by science, and we want to make sure that our patients know that, our providers know that. We're not just doing free willy-nilly. We want to make sure that we're being effective and impactful to our community. So our vision with you guys coming and knowing about these programs, I know everybody received a folder with a prescription pad. Most of you guys had the ones right on top, that purple one. That is the ones that we have designed for our county, which is we serve Morgan and Weber. These are the classes that we are currently doing, but the one on the bottom is statewide. So this is a nationally recognized program, but we have in Utah started a really big initiative to really push this program to our providers and to our community because they're free. We want them to be utilized, and we want us to be teaching these classes. We want our community to be educated, because if you guys have been working in hospitals, you guys are familiar with China, you guys are familiar with the CHA, with our community health assessments. Those are how we get these programs implemented. So we would like you guys, if you see that identify the need, you would prescribe this to the patient. So it would be depending on your discretion of like, oh, maybe they need help with diabetes, or they need help with their balance or movement. You would prescribe that to the patient. Then that patient would take it to the front office specialist or your medical assistant. And then that eliminates that barrier from that patient to actually take the step, or maybe they just don't know how to use the internet, or they don't know how to register, or there's so many barriers that could happen between that, or they just don't want to take the initiative. So we want to help them get there. So that MA or office specialist would register the patient by logging into the website and finding the nearest location towards them. So they would go in, type in a zip code. They say, oh, there's one around the corner. Let's sign you up for these dates. And after they get signed up, a community health worker will contact them and do the follow-up and do the hand-holding to encourage them to come to the class. If they need, if there's a transportation barrier, we'll help find some transportation for them to get to the class. Or maybe the class doesn't meet their times that they can do it, so we'll register them to an online class. We are seeing that as a public health official or representative, sometimes we try to think 8 to 5. We want people to come to 8 to 5, but that's the times we work. That doesn't work for our common community member. They're working too, so they can't make those classes. So we have to think out of the box. We have to, accommodate to what their needs are. So maybe we have to do later classes. Maybe we have to do earlier classes. Sometimes we have to do weekend classes. So we want to make sure that our community members are being educated, and that's where our community health workers have stepped in and really taken that load and really accelerated this program. So I want to kind of show them off a little bit in the next slide. But yes, this is how we would envision you guys using these prescription pads. So again, this is some data because we want to make sure that you guys know that we're doing the work. Since introducing the CHWs to this program and being our key leaders in the community, because these people are community experts, they are culturally competent, they get the education to teach these classes. Most of our participants are coming from community venues because our CHWs are going out to do the outreach, and that's how they're getting informed about these things. But we've had this program around since 2020, but COVID hit. Everybody know what happened with COVID. Everyone had those guidelines. We couldn't go out, so our program kind of just So after 2022, we started with chronic pain, and we didn't have good numbers because we didn't know what the community wanted, and we weren't meeting their needs. So you can see that most of the participants were getting some information from our local health departments, word of mouth, which is really common in our Latino Hispanic community. That's how they spread the word. And our healthcare providers is only 2.5%, which we really, really want to bump that up, and that's why we're teaching you guys how to use these prescription pads. We want to have this by 10% by maybe in 2 years. We want you guys to really use this and call us if you guys need help, or if you guys need more prescription pads, or if you need more information. We're willing to go to your guys' office and educate you guys how to use this and and you guys educate us how to be a better support to you guys. So here are a couple more slides.
I thought this may be the last real slide. Yeah, we might be nearly done. So just to quickly go over again, in the HEAL programs that I supervise, we also support a few other chronic conditions programs. The first one that we have is Pre-Diabetes 101. That's something that our CHWs and a whole bunch of us health educators were trained to provide by Intermountain Healthcare. It's a one-time presentation style class. Patients do not have to be diagnosed with prediabetes in order to attend. It can be people that are just at risk or people that would like the information. But in terms of supporting you guys as providers, we do have our screening surveys that we could bring to you. If you're a pharmacist, that includes you as well. And we're happy to come out to community venues, come out to clinics, and provide this education to patients as well. The burden does not have to fall on you guys to provide all this information. That is what we're here for. The second one I just want to quickly talk about is Diabetes Self-Management Education, or DSME. And this is a program that's specifically for people that have been diagnosed with diabetes. You may have heard of it. I don't know if anyone works with or is partnered with Ogden Clinic, but we have been working on workflow improvements with Ogden Clinic for several years now. And they have had really great success in implementing DSME with their certified diabetes educator. So this is not something that will be taught by us. It does have to be taught by that certified diabetes educator. But we do have resources available to help you guys start referring to local programs that already exist, to help you get your own program off the ground, or just some marketing materials if you wanted to hand those out to patients so they know what their options are. Self-measured blood pressure monitoring, or SMBP. This is a program for people with hypertension or at risk of hypertension to take that blood pressure cuff home and monitor their own blood pressure after they learn from you guys how to do it. There are several clinics that we've partnered with that have their own blood pressure cuff lending libraries here in Ogden and Weber County. And we're currently beginning the process of piloting another lending library at one of our local libraries as a hub for people to go get those cuffs there as well. But again, we have plenty of resources and materials if you would like to start your own lending library, if you would like to know where to send patients, if that's something that you think would benefit them. We are here to help. And the final program I just want to quickly touch on is NDPP, the National Diabetes Prevention Program. The only program that I'm aware of that really exists in the county right now is that of Intermountain Healthcare. They have their own program. But we are always looking for new opportunities with the lifestyle coaches that we have trained to partner with clinics or community venues to get an NDPP program off the ground. So if any clinics or providers are interested in that, again, hit me up, get my email, we can work it all out. But we have plenty of resources to go around, so don't be shy in reaching out to us and asking for a little bit of support.
For the final question, so referring these classes to my patients would be beneficial. We just want to see how you guys think these classes would be beneficial to your patients. I'm saying 100%, which is what we would love to see all the time. But if there is a no, we're happy to have a discussion and see where we can improve. So, well, it looks like it's 100%. That's a really good. We did a good job, you guys. But anyway, we would just love to have some feedback if this was beneficial to you and if it was useful and how we can improve as a public health representative for you guys. We want to be supportive to our providers, and we want to know what are some gaps you guys are seeing, because sometimes I have to put myself in some other person's shoe, and we try to do a newsletter. This is a little side story. We try to do a newsletter thinking, giving them some emails about our upcoming classes, and a lot of you guys told me, we're just inundated with a lot of emails. I know I'll never check those. And I'm like, oh, man, I thought this was just such a great idea, but it wasn't. And now we're going to have to go back to the drawing board and see how we can better support you guys. So thank you guys for staying and being supportive about this and learning. And if you guys have any questions, please feel free to contact us. So there is my contact information.